We are an organisation that began in 2005. We had, as a research group in Athens, we had already been involved in the issues of research and ageing. And then we realised that research doesn't really get you very far. What you should be doing is talking to older people, governments, policymakers about the situation of older people. So it's been a hard grind, but we've been getting there. And we are about the human rights of older people. Obviously, we've done an awful lot of training of older people, and we do a lot of different programs. So I would say we are now at the moment, we've got about 5 or 6 programs. Some of them are research, some of them are interventions and programs. And we are getting busy on advocacy so that we can actually work with government to see they too don't understand that they've got to think about this very large proportion of their population who are getting older and could be incorporated in a much more active way in their society. And I think that's really important for all our societies, that you do see older people as an asset and not as a has-beens or God, you know. It's really important that they're included in the society. And that's difficult because people have been talking rather badly about them, about somehow they're dinosaurs. They're not. Actually, the people who invented the internet are already older people. So we want to think about how to make a much more positive image of older people and positive actions, people working or volunteering and being much more accepted into the rest of the society. So that's our job, I suppose. We trained over 11,000 people using digital technologies, but it's always depended on the funding, and we worked at local authority level. And I think there is, what we're seeing is the uptake of new technologies quite quickly during this pandemic, but there's still quite a lot of people, and some of them people who mostly are going to be particularly in need of new technologies for health and care purposes, who are still quite illiterate. But it is changing quite quickly with the pandemic. It is important, of course it is. That's the way we're going. And if you're missing nearly a quarter of your population because you can't be bothered to ask them what they need, or don't find out how they operate, you're doing rather badly. And if you think too that we have a much higher life expectancy than we used to, but as some of it is lived, quite a lot of it is lived with disabilities for older people, some older people, then this thing about how to support them at a distance with new technologies in all kinds of health and care services is really important. We obviously all still can use the telephone, but the telephone isn't necessarily the only method. And using new technology to monitor, for example, people's health, to be aware of their developing health problems. You can think of a whole lot of areas where it's really quite useful. We've seen it with family carers, that family carers can be very isolated everywhere, by the way, in Europe, and we're trying to see new technologies used to help them do the care work, which in reality, an enormous amount of the support of older people who are in need of care is done through family carers, the husbands, the wives, the children, whatever. So new technology can help people who get terribly isolated doing this. And we need always to support people with new knowledge, what they can do to help themselves and to help others. So, for example, one of our programs at the moment is called Digital, and it's how to prevent the misuse of technology, the scams by people who use it. I mean, I constantly get American admirals looking out for me. I have to say, I don't know any American admirals, so I recognize it's a scam. But people are being brought up to be polite and actually to turn around and sort of delete a contact is really quite hard for people. You have to train people to do that. You can think of all the scams, you remember all the ones, the West African scams for money. You have to train people not to be scammed. I think there's other words for it. You have to be careful. You have to train people to how to use this new media in a way that is valuable to them and doesn't expose them. And I think, again, you can think of a whole lot of ways in which you can, if I say seduce, you can make new technologies extremely attractive to older people, because then they can talk and see their friends, their family members and so on. They can learn to do their shopping when they can't. And I guess a lot of people are learning to shop online in a way they didn't do before. You can think about family meetings that they can have. And we're beginning to get to ways of thinking about how our doctors and nurses can use this technology and offer support to older people. So there's a huge range of things where digital tools can be useful. And we ourselves are thinking hard about how to protect people in the way of using these tools, not to frighten people, but to actually support them in their use without being exposed. Two things we had happen with, and it's a good example, COVID-19, the virus. The government immediately put online for smartphones, for anything, to make, I don't know what you call it, to get the freedom to go out for a walk, go shopping, to visit doctors and so on. And you sent in a claim on a big, very fast website. There is also the possibility of printing it. There is also the possibility of writing it. So people are allowed to do it in many different ways. But it's so obvious that the smartphone method is really easy. You just, it reproduces itself every time you go out. There is a whole lot of government services now available on e-banking. And again, with the close down, this has forced a lot of people into trying to use and learn to use the banking apps. And again, we keep trying to talk to governments about this, not to governments, but to banks too. In other words, we're in between. We always will be in between, because there will always be people who find, for various reasons, that using an app or using the ICT technology in that way, digital tool, is not as convenient for them, for disability reasons, for panic reasons, all sorts of reasons, or even for ethical reasons. Some people have decided they don't want anything to do with new technologies because they think it's intrusive. People have the right not to use it. But you have to say we want people to have choices. They don't have a choice if they're not trained and know how to use the technology. So this is really important, that they are trained to use it. And that, of course, goes for health professionals, and it goes for care professionals, that they are also taught how to use it. Well, I've just said the government is using platforms for appointments for vaccination, for example. We've all booked, people are all booking through that. If they can't, they can go to a pharmacist and get it booked. Okay, so there is another method, but definitely vaccination appointments are happening. We're getting prescriptions electronically, and this is a kind of part of a more general push towards digital government. And if you talk about older people, this matters, because they are obviously people who are on pensions, need that information. They need information about what's available through health and social services. I don't know, a whole dozens of things. I'm just printing out, I don't know what parabola, their statements, government fees that you pay for the renewal of your license, driving license. After a certain age, you have to renew it, and so on and so forth. We are definitely seeing a push, certainly by the government in e-government, to get things all online and more simple. They used to be agony. So this is quite people, as they gradually get feedback from their family members, from neighbors, from friends, how easy it is, that will be another incentive for them to use digital technologies, I think. Have I used open platforms? Used it. As an NGO, no, we haven't. At least I don't think so, when we use so many things, but I'm never quite sure what an open service platform is. But if we're talking about health and social services, answer is no. Greece has been outside. It's not been in the AAL program for the last few years, and it still isn't. AHA, I'm not sure what solutions are actually there. So the answer is no, I haven't used either of those. But the government ones, definitely, they are coming into greater and greater use. When I talked about all those other things, about the conditions under which people who create the technology, who work with the new technology, have to think about the people using it. And it isn't only older people, but you can find technophobes at all ages, at all ages. So some of the doctors don't quite like it, but they're bright, they can learn it, but they need a little push to be encouraged to use it. And of course, there's a whole lot of issues about how you provide services and fund them. It's not simple to introduce care and health technologies when you don't know how to pay the people who are providing them. You do on national health systems to some extent, because you can make a fee for interview. But it isn't as simple. We've all got to worry about how people get their salaries, how we make an account for what they do, how we get feedback from those people who are offered the service and make sure that it is satisfactory. And it cannot be top down. It has always to be from the root, from the people who are using the service, up as well. And no system is good enough if it is just from the experts down. And it doesn't just matter if it's the technical people, but if it's from the health and care experts, it still isn't good enough. It's always about evaluating how well your service and what people really need at the grassroots level.